The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. Today is Friday, August the 26th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates with Bernie Simons, the Deputy Secretary for DDA. So on the panel today, we have Kate Obert and Jennifer Metrick with Liberty Healthcare. And before we begin, we're going to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and by phone. And if you look at the panel interface on your right, labeled audio, you can click either option, computer or phone, to switch for the best option. There are handouts for this webinar. There's been a little glitch. Some of you may not see the handout section today. I don't know what went wrong, but we're going to mail those to everyone after the webinar. We are recording the webinar, and we are going to post that on YouTube, and it will be on the DDA website. Questions can be typed in the question box or chat box in the webinar panel, and we'll get to those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon. Can you hear me okay?
Yes.
Good. So I want to thank everybody who is on this webinar for joining us today. And, we look forward to providing you with a number of updates and to hear directly from you. And as I said in previous webinars, your feedback is extremely important to me. So today, we're going to focus on a few updates. We didn't do a webinar since in July. We did one in June. July, we had a conflict with the rate advisory group, and I thought that was important for people to be able to observe and participate in listening to that. So today we're going to talk about the monkeypox, and I want to introduce Liberty Healthcare, and so that you can learn more about their role as a quality improvement organization. They were just approved by the Board of Public Works. We went through an extensive review of respondents to the RFP, and Liberty was a successful vendor. Next slide, please. And so on the 15th of August, we held our Technology First Kickoff, and that marks become us a designation for us in the state to become technology first, like we did back a few years ago with employment first. And this was a result of a lot of hard work. Over the years, a lot of people had done this. And, as you know, we've got the focus areas on like self-direction, employment, housing, self-advocacy, supporting families, etc. And so this will be our sixth focused area, getting into technology. As you can see on the screen, we had about 125 people there, and we had 23 vendors on site that had a lot of experience in multiple states. So obviously, you can see Secretary Beatty and myself on this shot, basically holding the governor's proclamation, making Maryland a technology first state. And, as we look forward to this, we can assist people to overcome barriers to accessing employment and housing and community services, and really being able to foster more independence. I mean, we learned some of this stuff with people wanting to be more independent during the pandemic, where we went into a lot of remote and using iPhones and other electronic devices and assistive tech devices, etc. So we had a great program, we had a great day, we had a lot of experienced panelists and speakers, and we'll continue to move forward with this. The event was live streamed. It's, I believe, on our Facebook right now, where you can go back and take a look at it if you didn't have an opportunity to see where we were during that day, and the event that basically was, I thought, outstanding. I thought it was well put together. We had some of our people from the Department of Disabilities present on a panel with people from DDA, etc. So it was great. Next slide, please. So throughout the month of August, we're going to start looking at where we are with a series of informational fairs. I think we've had all of them in place right now, and I think we've completed them all. There are 3 fiscal management and counseling service agencies, and they basically will give people an opportunity to select, who are self-directing, to select what FMCS agencies they want. These are new contracts, and again, this is all about giving people who are self-directing the ability to select and have a choice, not just to have one FMCS, but to have multiple. And you know, we've had fairs and well attended, and you know, I think that the 3 new FMSs have done a good job with the on-site face-to-face meetings, giving people an opportunity to meet them, and being able to make a selection about what agency that they would be interested in, and being able to learn more about them so that they can make an informed decision. Next slide, please. So we know that we've done a lot of partnership with the Department of Disabilities over the years, and you know, after a busy month with you know, everything we're going on with providers and transitioning into LTSS from PCIS2, with the FMCSs, with the advent of the QIO, which we'll get into in a little bit, that we're now moving into the month of September, and you know, that's when we usually celebrate. You know, you can see the dates, September 11th to the 17th, to really celebrate our Direct Support Professional Recognition Week. You know, we've done that again every year with the Department of Disabilities, you know, to select individuals who are really special and dedicated their lives to supporting people with intellectual and developmental disabilities. So, you know, they've done an outstanding job. They're dedicated. They're the backbone of a lot of our services. And, you know, I just want to make sure that we recognize them and our agencies to honor folks from the 17th, from the 11th to the 17th. And, you know, again, you know, if you could start submitting and visit our Facebook page and submit entries on or before the 9th, and then we can move forward with recognizing some of these individuals. So again, as it says on the slide, nominations are due on or before September 9th. And I appreciate everybody's cooperation in being able to submit folks to be recognized for their hard work and dedication. Next slide.
Hi, my name is Rhonda Workman, and I'm the DDA Director of Federal Programs. And we'd also like to remind you about the DDA's Appendix K flexibilities that are currently in place are scheduled to end on September 30th, 2022. If there's any changes to this date, we will follow up with you as soon as we can with any additional information. However, as we have been urging the DD community all along, it is imperative that you have your transition plans in place for a phased unwinding of the flexibilities that have been in place. Please continue to work with your teams around these flexibilities. And we thank you for all that you continue to do to keep the individuals we serve, their families, and each other healthy and safe. Our current guidance for these flexibilities are on our webpage, and a link is noted here for your view. And also as a reminder, people self-directing their services and providers need to ensure that all staff meet the required service qualifications, including having current required training for CPR and first aid on or before September 30th. In addition, providers need to ensure that they have current DDA licenses and certifications on or before September 30th. And now I'm pleased to introduce Adrienne Holloman, Director of Nursing Services for the Developmental Disabilities Administration. Adrienne joins us today to provide us with updated information about the Maryland Department of Health's response to the current U.S. monkeypox public health emergency. Next slide, please.
Good afternoon, everyone. We know that our COVID-19 response remains active and encourage you to continue to follow the established protocols and use the resources available. While we are together today, we also want to provide you with information on monkeypox, as this has been recently declared as a global public health emergency. Fortunately, the prevalence in the U.S. is relatively low, but information is our best tool for keeping us safe. The monkeypox virus is part of the orthopox virus family that includes both smallpox and cowpox. It is spread through direct contact with skin lesions, clothing or linens from an infected person, or rarely through prolonged exposure to large respiratory droplets, generally greater than 3 hours. There is an available vaccination or vaccine for it. However, it is recommended for the not recommended for the general public, but rather for individuals of highest risk and those who have been in close contact with confirmed cases of monkeypox. Next slide, please. This slide illustrates the CDC's total number of confirmed cases in the United States. As you can see, Maryland is in Region 3 with a total of 431 cases as of August the 23rd. Next slide, please. The Maryland Department of Health's Public Health Administration Unit continues to monitor the global human monkeypox outbreak and provide resources information to clinicians and Maryland residents. Check the website often for regular updates. You see it includes clinician letters, frequently asked questions, testing guidance, videos in English, Spanish, and American Sign Language, and fact sheets for the public. For our DDA residential providers, please continue to reach out to your regional nurse and to myself, as we will remain a resource to you as you work to keep the individuals and their families and their staff and your staff safe. Now I will turn it over to Deputy Secretary Simons to continue this month's presentation by introducing the DDA's new quality improvement organization, Liberty Healthcare Corporation. Thank you.
Okay, next slide. So I'm pleased to introduce, as I mentioned earlier on in my opening remarks, our newly contracted Quality Improvement Organization, or otherwise known as QIO, to the DDA staff and the community today. Jennifer Metrick and Kate Olbert, both from Liberty Healthcare, are here with us today, and we look forward to hearing from them and them sharing their information with you. The contract is extremely important to me. It's been my longstanding commitment to services, and that there are accountabilities. Many of you know that we've had some issues with audit findings where we have to go out and verify with the services that were identified in the person's PCP actually delivered or not. So, you know, there's the accountability piece, and that we have to remain person-centered. And so a QIO here in Maryland will, you know, expand our resources and create new opportunities, and we should be able to hear from them and get some feedback from people in supports and their families. And, you know, it's your voice and experiences that help us to improve our services. One of the areas that they will be taking the lead on is the national core indicators, which is, you know, how well are we doing in DDA in delivering services? And many of you have participated in those, and they were mailings, but starting next year, we will be doing face-to-face interviews with Liberty, basically having individuals with intellectual and developmental disabilities doing the interviews, et cetera. So, you know, I think we're well positioned there. We also will be looking to become a network accreditation. We will be the second state in the nation to do that through a CQL, or the Council on Quality Leadership. And what does that mean? That means that DDA as a state agency will be accredited, and that the provider agencies that we work with and contract with basically will have to come into compliance with policies, procedures, and everything that it will make us a stronger, better system. And so, I don't think it's going to be a lot of a change. I think many of the providers already have individual provider accreditation from CQL or other national accreditation bodies. So, this will be good, moving us forward. And again, it's DDA who will be accredited, not the providers. The providers, by again policies, procedures, etc., will help strengthen our system. And I think as we move forward, we want to, have some capacity building and, some good quality enhancement and, moving forward so that we can always look at this as it's not a final destination, but, it's a journey. We're learning as we move forward. You can always learn, you can always get better, you can always improve. And that what we need to do is make sure that the quality of the services are reaching the individuals that we're providing supports to, and that we all do the best that we can and think about is it the best? Can we do? How can we improve? I mean, the whole issue right now about, we talked about technology first a little bit earlier, and about assisting people to become more independent and, thinking about enabling technology, as it's called in some states, as opposed to assistive technology. It's enabling the individual to become more self-reliant. And so with that, I'll stop my remarks and I'll turn this over to Kate and Jennifer to join us. Thank you.
Thank you. Do we have that presentation for Liberty for the next slide? Thank you. Well, good afternoon, and thank you for spending time with us today at Liberty and allowing us to introduce ourselves. I'm Kate, and I'm serving as the contract manager for the QIO Maryland project, and my colleague is Jennifer Metrick, who is the executive director and local program lead here in Maryland. Liberty is very happy to be supporting Maryland DDA during this exciting time. We look at it as an opportunity for enhanced system transformation that Deputy Secretary Simons is speaking to, and all of DDA's visions and goals to improving quality and satisfaction, protecting integrity, all of those wonderful vision, and being able to assist with that. Today is intended to be a broad overview and introduction. There will be more webinars and lots of communication on the details of the activities we're going to be working on with the state that that Deputy Secretary Simon spoke to, such as the NCI, National Core Indicator Surveys, the reviews, and the CQL network accreditation. For today, we hope that you leave with a general understanding of what a QIO is and the work we will be doing with all of you together, and to be able to ask questions you may have that is presented. Can I get the next slide, please? So you may ask, what is a QIO? Many of you may never have heard of this term before. It is a group of experts that help to shape policy, practice, tools, and data, and to improve the life outcomes of people within a system. I like to think of QIOs as guides for states who are typically looking for system transformation. They're typically on a journey from compliance to quality, or trying to find a way to balance between the two. We're looking for a blueprint on how to bring successful change to best practice in their service delivery system. QIOs focus on partnerships and engagements to help shape a vision of quality and system changes, and that's incredibly important. QI focuses on the voice of staff, the voice of families, and most importantly, the voice of individuals in the process. QIs raise the bar and standards and help strengthen and enhance capacity building in the system for everyone. QIOs enhance the capacity to collect information that helps drive important decisions that get to the outcomes we're all looking to achieve together. Ultimately, QIOs bring technical assistance on if best practices are being utilized and support to get us there. Can I get the next slide, please? You may ask, how do QIOs help states and the people supported in the service delivery systems? Most systems have data that drive what they do, but Liberty has learned through many QIO projects that to be truly person-centered, systems need to talk to those in support so they can share their experiences, their ideas for improvements, and their vision of a good life. QIOs identify where we need to do things better and make recommendations so that services are guided by person-centered outcomes and that people are getting more of what they want and not what they don't want. And to ensure services and supports are not a barrier, are changing, dynamic, and responsive, and change over time to reflect how a person's needs, desires, and visions change over time for their life. Can I get the next slide, please? Liberty has provided QIO services in 3 other states, including Arizona, Indiana, and Nebraska, and the District of Columbia, and it has a long history of over 30 years of working to support individuals receiving services. We provide a toolkit to strengthen the service delivery framework, a plan to help on the journey, as well as some really cool tools we have built while working with collaborative work groups with person-centered experts, individuals, advocates, families, providers, and many other folks involved in the process. We've taken those lessons learned from those experiences in other states and have focused this for the Maryland QIO on 4 important factors. To ensure people are at the center of their services, we're utilizing an experienced Maryland-based team members in our project, building collaborative relationships with individuals, families, providers, and stakeholders, and building a culture of quality. As you know on the slide, just wanted to call out with working with some of our partners across the nation. We do work with the national independent assessment projects and the local assessment teams in North Carolina for the Department of Human Health Services. And they just wanted to call out how resourceful and responsive a partner that we have been in collaborating with them. We've been doing assessments and quality work there for more than 8 years and really helping them through their managed care transformation. So we really focus on a service model of really transparent collaboration and working with all the stakeholders in the state when we do services. Can I get the next slide, please? The life course looks at what individuals want and what is important to them. The QIO recommendations that we give are based on being person-centered and getting to integrated services and supports. Through having conversations with folks in services, engaging in problem solving with service teams, and visioning what a best practice service could look like, QIOs discover that when individuals are not receiving what they want, the QIO recommends changes so that people receive the best possible supports that lead to a fulfilling life. I'll give you an example of the work we have done in the last 2 years in the state of Indiana. A simple basic activity all of us experience every day is mealtime. And looking at services individuals were receiving in Indiana, we identified data from one of our reviews that there was not freedom of choice over food. Individuals did not have access to food that they wanted whenever they wanted to eat it. So we engage in technical assistance with the service team on how to implement food meal kits so the person was getting the foods they wanted. We also engage in problem solving with the staff and how they could shift their perspective that they didn't need to cook a family style meal for 3 people a day, but how they could assist 3 individuals get their meals prepped the way they wanted them prepped. This helped them to be compliant with the settings rule and with the support the individual wanted. We took this trend from cross-pollinating data from the personal outcome measures, the NCI data, and Liberty's quality provider on-site review. Liberty's approach always focuses on ensuring DDA participants are driving their service and that what is important to them is to focus on how they receive services and supports and also identifying provider strengths. Next slide, please. Sorry, can I get the next slide? Can I get the next slide? Sorry. There you go. Thank you. It is important that the QIO team is led by and involves people with Maryland-based experience that understand how the DDA system operates, the people that the system supports, and the vision and mission of DDA. Liberty selected an executive director, Jennifer, who is on the call with us today, and who has experience working for a Maryland DD provider organization, and someone who has an earlier adopter of LTSS assisted the state and providers on ways to successfully make the transition from PCIS2 to LTSS. Liberty also is focused on hiring QIO team members that have Maryland-based DD experience. Equally important, though, Liberty uses experts in IDD to help support the development of policies, procedures, and tools, and our subject matter experts who bring promising practices from our other QIO projects. I'm now going to hand over the next slide to my colleague Jennifer to talk about collaboration.
Good afternoon, everyone. Thank you, Kate. As Kate mentioned, I'll be the Executive Director of Maryland's QIO, and I just want to let everyone know how excited I am to be here partnering with the DD community as we launch this really exciting initiative and really trying to reach towards that person-centered excellence that we can do through the Council for Quality and Leadership's accreditation process over this journey for the next 5 years, because it will be a journey and we are just getting started. So at this point, we want to make sure that there are many opportunities for collaboration, especially as we get started, and to be able to support and design the implementation activities. We want to make sure there's voice of participants, families, and providers all at the table, helping us move forward in a way that makes sense for Maryland. So there's going to be quite a few different opportunities that people can provide input and feedback. One of them is going to be through the development of a collaborative work group. So we will have information attached to the materials that will be sent out today around how that collaborative work group will be formed. There's a link as part of that you can go on and select to be a participant of that. We'll be making selections in the next couple of weeks so that we'll be able to get that started by the end of September. And so there's more information in the summary guide that you'll have along with that link. We also will be coming out on a regular basis to all of the regional provider meetings so we can have more intimate conversations around the QIO work, be able to field questions and gain feedback through that mechanism. As Kate mentioned, we'll also have more detailed webinars around the Council for Quality and Leadership's network accreditation and the National Core Indicators Survey, as well as the other components of the evaluations that we'll be doing as part of the QIO. So this is certainly an overview, but we want to be able to break all of this information down and into bite-sized pieces and give people multiple opportunities to ask questions and provide their viewpoints. So another area that we will be asking for participation in our initial process is around asking for volunteers to help us pilot some of the tools that we'll be creating as part of the QIO, either within your provider organizations or helping us with our practice interviews and getting trained on CQL measures such as the personal outcome measure and basic assurances. So we're definitely wanting to ask for participants early so that we can get those opportunities set up for later this fall. All of that is part of the survey link that you'll be able to complete and say the kinds of ways that you would like to participate as an individual person and or an agency. So next slide. So another key component to the success of the work the QIO will be doing is around building a culture of quality. And what we mean by that is really focusing on not only the quality of the entire service delivery system, but how is that impacting people, and are those components of the system really driving towards helping someone have their best life? And so this quality is everyone's responsibility. We are all in this together, and we are going to be on this long journey for the next few years, step by step, trying to reach for those higher levels of quality and be able to implement best practices. So we're hopeful as the QIO that not only can we be able to collect the data that's going to help the system to make great decisions and look to best practices, but we can provide some technical assistance from our knowledge from other states, as Kate mentioned, in how we can go about some of those best practice strategies and really then again strive for that person-centered excellence. So we use evidence-based methods to be able to do that. And we really look to try to have a more planning approach and proactive to focus on how do we get to those outcomes? How can we improve components of the system and build on the things that are going really well in our service system today to improve the lives of people supported by the system? And I typically break this down into 3 areas. When we're evaluating services or a program, you look at performance measures. And there's 3 different kinds of performance measures. You collect how much, those compliance, are we meeting standards that are outlined in the waiver or our policy stack guidance. And then, but how do we reach to how well? What are some of those best practice standards that we can infuse in the system to look at and make sure that we're looking at how well? So not just that did we do it, but how well did we do it? How do we ensure voice from participants as part of that? And then let's make sure that we're measuring outcomes on, are people better off? Are we actually helping them reach their good life? And so those are the 3 simple components that are going to make up our evaluation work. So next slide, please. So we will have several different implementation milestones as part of the initial about 6 months of the work as we're moving towards being able to launch each of the components. So certainly we're starting off today with a kickoff webinar. We had the opportunity to talk to the full DDA team yesterday. We're going to start the collaborative work group by the end of this coming month in September. We're going to have additional webinars, piloting of our data collection processes and tools. We'll also have some additional training that the Council for Quality and Leadership will be coming in and providing as part of this process. We want to make sure there are multiple opportunities for us to learn and grow together before the launch of the evaluation components that will be comprised of the QIO. So next slide. So I wanted to pull together all of the responsibilities of the QIO and how they address the how much are we doing? Are we meeting those basic compliance standards? How well are we doing? And are people better off? So with the component around the waiver assurances, there are 6 waiver assurances that the DDA system needs to report onto to CMS to ensure that we are providing the services and supports as we should, as outlined in the 3 waivers. And so we will be looking at 5 of the 6 of those assurances and creating evaluation components around those. And they are going to include much of the compliance, are we meeting standards, our services in alignment with people's person-centered plans, and then we will move towards more of the how well are we doing. We'll do some of that as part of the waiver assurance monitoring, but we'll also be able to do that with our national core indicator surveying, where we'll be able to hear directly from participants and their families about their experiences with surveys and then, or with services. And then finally, that pulls us into, well, how are we going to evaluate the impact of services and people's outcomes? And that's where the Council for Quality and Leadership Network Accreditation, they are going to be walking us through a process that helps us move towards person-centered excellence. And one of the measures that we are going to be collecting as the QIO is the personal outcome measure. So that can really help us to see, are those outcomes being met in somebody's life? And so more to come with that, but part of the outcomes of the QIO are to ensure that we are strengthening stakeholder engagement as part of this work, that we are using best practice approaches and that we are able to, as a state, qualify for enhanced federal match dollars around the QIO activities. So next slide. So one of the core components, as I mentioned, was the Council for Quality and Leadership's network accreditation. And as Bernie mentioned, this is a journey, and we are on a journey for the next 4 to 5 years to try to be the second state in the country to reach that person-centered excellence accreditation with CQL. They are going to be driving this process, and they are an incredible partner to the QIO work. The QIO is going to be the data collection mechanism for that. The webinar that we'll be having in September will include team members from CQL, and they're really going to walk us through the 3 major phases of network accreditation. And so more to come on that. We just wanted you to know that that was coming, and that they are going to be partnering with the state as we start that journey. So next slide. Here we have the National Core Indicator surveys that we'll be conducting as part of the QIO, and we are very excited to have another great partner at the table for this work, and that's People on the Go Maryland. So they are going to be helping Liberty Healthcare to recruit and train and support advocates with lived experience that will be part of those interviews with adult consumers or adult participants. So those will be either face-to-face surveys or done remotely, depending on the preference of the person being interviewed. And so that will be 2 reviewers working together, a quality reviewer and an advocate reviewer, collecting that really important information from people about their experiences and their level of satisfaction with surveys. We also will be doing the adult family survey and the family guardian survey. The difference between those 2, they will be mailed surveys, are the adult family survey is conducted with those that have family members with IDD living with them. And then the second survey is families or guardians where they are not living with the family. And so, or they may be living independently or in a community group home. So we'll be doing those mailed surveys in November, and then we'll be doing at least one other additional mailing to try to capture as much information from families across Maryland as possible. So next slide. So I just wanted to talk a little bit, and we're going to go into much more detail about this in the coming months as we're creating the reviews around the waiver assurances. But I wanted to give you just a quick understanding of what those reviews will entail. So first we have the level of care reviews. That's looking at the timeliness and effectiveness of the eligibility process. We have our service plan reviews. This is around the completion and the quality of our person-centered plans, as well as how we are following up and monitoring on people's goals, their health and welfare, those components related to the work of coordinators of community service, and the process within the person-centered plan. We also will have 2 clinicians on our team that will be doing health and welfare reviews. These will be focused in 3 areas. We're going to be looking at the effectiveness and quality of the HRST screenings. We'll be looking at the impacts of the incident reporting system, as well as some other critical incidents that may lead to hospitalizations, emergency visits, and things of that nature. So again, it's about ensuring people's health and welfare and looking at that higher level of approach of where are we doing really well in the system and where are there opportunities for improvement. We also will be coming in and doing qualified provider reviews. So this is, as Bernie mentioned, we're really looking at ensuring that the information that's provided through licensing and certification is verified, the standards are being met, and there's documentation to support that. And then also being able to help us, again, strive for that person-centered excellence and making sure that we're including quality indicators to help us come in further alignment with the home and community-based settings rule and person-centered approaches. And then finally is the financial accountability reviews. Certainly it's important for the DDA to assure that the claims that are being billed and paid for are matching the documentation associated with that service. And so there will be reviews of matching that information as part of the process. So again, we're going to be building, it's going to be looking at how much, that compliance component, as well as how well we are doing in each of those areas. So next slide. All right, so what to expect? We want to make sure that we are providing as much information as possible to the DD community. We are going to be launching a QIO webpage that's going to be connected to the DDA website. That's going to launch in the next day or so. That's where you're going to find information from things like this webinar. It's going to be where we have posted the work group summary that I talked about, as well as the link on how to request participation. We are going to have a robust frequently asked questions document that's put up on the site. We'll be doing that next week because we want to incorporate questions that may come up at the end of today's session. So we really want to make sure that as we are creating documents, as we're creating some of our tools, we have opportunities for people to be able to share and provide feedback. So we'll put as much information on that page as possible. As I mentioned, there's going to be quite a few opportunities to participate. So I just ask that all of you consider different ways that you might be able to participate in the QIO development. We're really looking forward to collaborating with the full DD community and want to make sure that everybody has their voice heard in this process. So from there, I'm going to launch into questions. Oh, and sorry, our contact information is here for Kate and I so that you have a direct link to us.
Wonderful. So thanks, Jennifer and Kate. We're going to start with our QIO questions. And it looks like for you, Kate, I have a couple of them. And then Dr. Smalls will read the ones for you, Jennifer.
Okay.
So, Kate, is QIO talking with direct line caregivers for feedback or just administrative staff and providers? And how often is information gathered and reevaluations done from what you've done in other states?
So work in other states, and the intention in Maryland is we do speak with direct line caregivers. When we go out and engage in conversation through some of our quality reviews, we directly speak to individuals in support and their service team and their families and support team pretty regularly. And what was the second part of the question?
How often is information gathered and re-evaluations done?
So we gather information every day, every week, and every month. We go out and put that all into some reports, and then we do follow-up, and then we go out and make a plan with different individuals that we come across, and then sometimes that is more frequent than not, depending on the level of technical assistance they're requesting or that we discuss as far as an improvement plan. And some of that improvement technical assistance and improvement plans means ongoing engagement. So sometimes that can be for a day up to several months. And we go back and touch base. We've had training and engagement folks that have been doing ongoing support with some individuals and providers for well over a year as they look at ways to improve things and they want feedback and they want assistance. They sometimes request us to come back multiple times, and sometimes they put that in as part of their plans to improve. So it varies across the stage, but we routinely collect on a daily basis all types of information, look at that information and provide a lot of feedback and engagement to folks.
Great, thank you. And the next one is feedback to QIO anonymous to ensure unbiased and unfiltered feedback?
Is feedback to the QIO anonymous?
Yes.
So when we typically, when we go out and do different activities, depending on the methodology that we use, some of it's anonymous and some of it is not. It depends on the activity we're doing. And we usually give a summary back to the care team that's involved with that individual. We always give information that the individual shares to our team and our reports that we share to kind of help them meet their goals. But it really just depends on the activity that we're interacting in the process.
And from your past experience, how will nonverbal participants be surveyed?
So typically, they have supports in place. We ask in advance what and look at what some of the needs are, and we utilize their service team around them to help make sure that we can engage in conversation with them. Typically, you know, we have some augmented services that we utilize, like interpretation services that people may need, and we have a lot of folks that have their own certificates, but we usually use the support team that the person has as a means for communication.
Great, thank you. I'm going to turn it over to Dr. Smalls, who's going to ask the questions for Jennifer.
Okay, thanks so much, Kate. The first question, Jennifer, is do you have a tool that you will use in your provider visits? If so, will the provider community have access to the tool to make sure that they are keeping records needed to show utilization?
So there's two different components of that question, but yes, we will be developing tools, and that will be part of the collaborative work group is going to provide feedback and input onto those tools, and they will be shared, and we will be going through training as we prior to coming out and launching the provider reviews as well as utilization reviews. So the utilization reviews are part of that a financial accountability component. They're focused on claims and claims review from a statistically random sample. The provider reviews are around the qualification requirements. So there are two different tools, but yes, we will be sharing that and providing information along the way to understand what would be required as part of that process.
Okay, thank you. The next question is, how does this QIO process interact with participants who are self-directing their services?
So as part of the qualified provider reviews, self-directed providers will be included as part of that. So, and I forgot to mention that, so great question. We are going to be looking at, we'll have a tool for standard providers, OHCDS providers, as well as self-directed. So we will randomly select a group of self-directed providers and walk through that qualification review tool with them.
Great. Next one is, when is the survey link for the QIO coming out?
The survey link is it was on the slide. So as soon as you get the slides, you can click on it right there. You also will see it on the web page once that is launched later today, and that there is a summary of the collaborative work group, and there is a link as part of that summary in that document.
Thank you. These are all really great questions. Will the QIO work precipitate a change in how we will write and collect data for our current annual DDA quality assurance plans? Should we align the external review from the QIO and the internal?
At this point, I don't think anything changes with the quality enhancement plans that are being submitted. We will be providing summary reports in aggregate, either by region, across the state, so that information over time may cause providers wanting to add new components to their quality enhancement plans, but not at this time.
Okay. You noted milestones way back on slide 22. Do you have months or quarters or years when you expect those milestones to be reached?
Yes, so those initial milestones we will be doing in the next 6 to 9 months before we are launching those evaluation tools. And not everything launches at the same time, and it's also determined by how long it takes us to get finalized tools and processes in place, and then be able to train those that would be interacting with those tools and processes. So I would say for the most part, we're looking at that initial implementation time is around 6 months, 9 months if we have to push anything out.
Thank you. How will the QIO collaborate with the Office of Healthcare Quality?
So as we do with the regional DDA teams, we will be providing summary reports of the information that we're finding. I didn't use this analogy in the presentation, but I used it yesterday with the DDA team. The QIO is really looking at an expanded viewpoint in terms of how well our system is doing. Where are we doing really great work, and where are those areas where we might be able to improve? So with our specific roles within the system, whether that's a regional office or a CCS organization or provider, OHCQ, they're looking from a specific viewpoint and lens, and they're working day to day on individual cases with individual providers. We're going to be expanding that view so that we can see all of the components together to try to help us make sure that we're improving health and welfare, for example, or our person-centered planning process. So we won't be taking any of the roles and responsibilities that are already associated with, let's say, OHCQ or a DDA regional office. We'll be looking more at that expansive look and trying to connect the dots to help us towards that person-centered excellence.
Great. The next question is, will CCSs be included in your information gathering? And will CCSs be evaluated as well?
Yes. So we will be looking in 2 ways. We'll be looking at paid claims and the support that those services were provided within the standards of the service definition and the units and all of those components. That is the same for provider services as well as the targeted case management. The second area is around looking at some of our processes as part of the waiver assurances, the person-centered planning process, the monitoring of people's goals and the quality of their services. All of those are components of a case file review that will be part of the QIO activities.
Thank you. How will nonverbal participants be surveyed?
I think we talked about this a little bit. Kate had talked about how we would be doing that. All of the participants in the system have support. So depending on if those that communicate with alternative methods, we will be looking to the support team to help them through that process. We will make sure that if we are working with the team in advance to know those components, to best know how to communicate with the person so that they have their voice heard.
Excellent. Yeah, we had a couple repeats.
Yes.
How often will compliance reviews occur at a particular provider site?
So we will be doing the selection from, it's part of a statistically random selection on a quarterly basis for most of the quality reviews that we'll be doing. And we'll make sure that we're not doing repeats quarter to quarter, but there is certainly that opportunity that a provider would be selected in that quarter.
Okay, thank you. Agencies have QA plans and internal evaluations that measure program quality. Will these reports, which DDA already has, be used as a foundation to get baseline data before the reviews happen?
So we certainly could include that as part of our reviews. The tools themselves will, again, that's specific to a provider or to a specific person. The tools that we'll be using will potentially include some of that information, but will be a standard set of really what are the compliance factors, how are we meeting standards as outlined in the waivers and policy, and looking for areas of congruence around that and documentation. So that may include provider's QA plan.
Thank you. All CCS agencies will be evaluated, right? Not just a select couple, since the health
Correct.
departments are very different than the private providers. There's a concern.
That's correct. All CCS providers.
Okay. Will the work groups be in person or virtual?
For time and convenience, the work groups will be virtual.
Great. Thank you, Dr. Smalls, for reading all of Jennifer's questions. We have about 2 minutes left. There has been a lot of questions about getting a copy of today's presentation. Please know that this is a handout on this presentation. You can pull that from your right hand and download it. If you're having an issue or problem with that, we are going to be posting this webinar on the DA's web page. And also, as you heard Jennifer said, it also will be in the QIO landing page of the DDA website. I am now going to turn this over to Bernie to close us out.
Okay, so you see it on this slide, our upcoming monthly webinars. So I'd ask you to please share this with your colleagues, participants in our services, families, etc., and to please register so that you can have real-time information from these webinars or on these webinars. And after you register, you obviously, like today, you received a confirmation email about how to join. And again, I want to thank everybody who presented and everybody who attended today. And as always, we look forward to getting feedback from everybody so that we can update our DDA, our frequently asked questions document, And with that, I am going to end because we're about just at 2 o'clock, and I hope everybody has a happy and healthy weekend. Thank you.